Okay, I think that's my cue. Uh, Thank you, everybody, for coming, first of all. Today, I was going to talk about swallowing and also talk about that big name up there, fiber optic endoscopic evaluation of swallowing. From here on out, I'm calling it FEES, and I'll go into what it is. It's a very long name for a swallowing test.
Yeah.
All right.
You actually got it.
You guys know about projecting your voice, right?
Yeah.
Yeah. All right. I will project. Using my phone. Okay. What I'm going to talk about today is just in general, what is speech therapy? I did do a talk here in the fall, I believe it was, just talking a little bit more in depth about speech therapy, which I'm sure we'll repeat at another time. So I won't get into too much detail, but just in general, because there's a lot of things that fall under the speech therapy umbrella. But today, of course, there's going to focus a little bit more on swallowing. I want to talk about normal swallowing because it is a very complex task that we all do and we don't think about it. But there's so many things that are involved. So I wanted to kind of just go through it in general, just so then you can get an idea of, okay, I know what normal swallowing is like. So then we'll go into what could potentially be, I don't want to say abnormal swallowing, but maybe a swallowing difficulty and some things that you could see, some signs of some swallowing difficulties. And this could be a lot of different things. So I'll kind of go through that. And I wasn't going to go super in depth into specifics with Parkinson's because it is very variable. So in general, I was just going to talk about difficulty swallowing, but of course, a little bit about Parkinson's because that's why we're all coming here together. And then I'm going to talk about FEES, what that is, and then how can we help you in regards to swallowing, okay? And then I just want to talk a little bit really quickly about me. I went to Nazareth College in Rochester for my undergrad. I went to Syracuse University for my graduate program. This is, I guess, aging myself, but I've been a speech therapist for 13 years. Prior to coming to Engage, I was at Upstate Hospital for about 11 years. So I have a lot of experience in a lot of different areas. I am Speak Out certified, which is a program that is very highly researched for those with Parkinson's. So I can provide the Speak Out program to help with voice and speech. And I'm a certified brain injury specialist. So there's some criteria, there's a test involved, but it just shows that I have some advanced knowledge with working with those that have had brain injury. And then I attended the FEES course in March of this year. It's a weekend-long course that I'll go into what FEES is, but it's a swallow study. And you just have to have specialized training. So I attended that in March and I've been doing it ever since. I didn't introduce Kate in the back. She's in the back corner. She is a graduate student from UMass Amherst, but from Syracuse. She's been with me since middle of May. So she is officially graduated if I pass her. And she's only got another week with me, but she came to join us. So what is speech therapy? A lot of things, like I said, fall under the speech therapy umbrella. So first of all, voice, and that's a big one for Parkinson's. We see sometimes some changes with voice volume or quality, or so it could be hoarse, it could be gravelly, raspy, reduced volume. So all of those things that fall under voice, we can be of help with. Speech, or what we call intelligibility, of how clear you sound, we can help with that. So that might present as sounding, people say slurred, or sounds like I'm drunk and I'm not, mumbly, words like that is the way that some people describe their speech. And then of course we can help with that. Language, so that would be speaking. So thinking of words, it could also be understanding language. It could be reading, writing, all of that all falls under the language branch. Cognition, and that could be anything with your thinking skills, memory, problem solving, reasoning, all sorts of things, helping with managing medications or bills or things like that. We can help with that. And then what we're going to focus a little bit more on today, of course, is eating and swallowing. So that can be anything from chewing to the actual swallow function to using different positions when you're eating and drinking, strategies, things like that. And then again, at the bottom, the swallow test, which I'll talk about two different ones and more in depth, of course, is the FEES, which I'm just keeping you, in suspense about what that is. I hope everybody can see this, but I wanted to just have you be able to kind of visualize what is going on the inside. So on the left is a side view. So if I was standing like this, that's my side view of that picture on the left. Do you have a laser pointer, Pat, by any chance? Okay, that's all right. That's okay. They are labeled, but that you can kind of see, you know, the lips on the outside. You can see the side view of the teeth, that bulky thing, that's your tongue. And you can see above that is your nasal cavity where you breathe in through and out through your nose. And then you can see then it goes down into your throat. And you can see where, I don't know if you, hopefully you can tell where it says vocal cords, that's the start of your airway. So you can see they're right next to each other. So that puts you at risk of things going down into your airway because they're right next to, it's right next to the stomach tube. The picture on the right is a view of your airway from the top. So if you now think the camera is hanging like this at the top of my throat, that little triangle, those are your vocal cords. Those vibrate and come together when you talk. And that is, and then right on the back side of that is the opening to your stomach. So you can see how close they are together. That's why we want to talk about swallowing, because it's very easy for things to go into the wrong tube because the right tube is right next to it. Any questions about just kind of visualizing what's going on the inside? Front to back. Okay, so your airway's in front of your stomach, your esophagus. Yep. Where's the esophagus? So can you see where the spine is on the left picture? Right in front of that, you can see that pink tube, that opening. You see that? It's, yeah, darker, thank you. This picture is a little bit off because at rest, when you're not doing anything, there's actually a sphincter that's closed until you swallow. That's when it opens. So it's actually open right now. So hopefully this person's in the middle of their swallow right now. Okay. Normal swallowing. Okay, now that you have that in your pictured in your head, the first picture, so you can see the yellow, that's going to be our bite or sip in all of these pictures. Okay, so the bite or sip is going to enter your mouth. You can see it in right there, like kind of sitting right in the middle of your mouth. And if you're eating up food, you're chewing it in this part of the swallow. If it's a liquid, you're just holding it there, usually briefly, just to get it all in one, what we call a bolus. So that's when you just prepare that bolus to be swallowed. Then the back of your tongue is going to take over and move it to the back of your throat. So in that second picture there, you can see that your tongue is kind of starting to bring that bolus down, right? So a lot of things, and I listed them right there, a lot of things have to happen now, and they all have to happen exactly in sync and correctly for it to go well. So without getting into too much detail, your throat kind of compresses together, your tongue comes back to push it back, a flap goes down, things compress, things open, things close, without getting into too much detail, but that's a lot of things, right? A lot of things have to happen all in sync for things to go well. So you can see now, all of those things went well, so now it's starting to go into your stomach tube. That sphincter opens up, it goes down, and then your esophagus takes over, pushing it down. Questions? Very complex, right? It's about, it's like 50 muscles that all have to do their thing once that food or drink enters your mouth. A lot of things. And we had to learn it in school. Can you name all 50? Go. No, it's a lot has to happen, okay?
50 muscles. They all work when the swallowing problems start, or one or two?
It could be one or two. It could be one little thing. It could be a group of them, because they're all kind of intertwined, you know, and it's 50 starting from when your lips go to grab the food, right? So it's anything from your lips to when your esophagus starts pushing it down. A lot of things, okay? So this is why we're going to talk about swallowing difficulties, because there's so much involved, right? Okay, here's a list of things that we could see, but this is not everything, right? I'm just going to go through and kind of maybe elaborate on a few of them, just in case you guys can't read all of them. So we've got drooling or poor management of the saliva in your mouth. Okay, so that could be weakness of your lip muscles because they can't keep it closed. It could just be awareness of the saliva in your mouth. I could go on, right? Food or liquid remains in your mouth after the swallow. So you aren't able to chew it up well enough and it's just sitting in your cheek. And that could be, again, weakness or awareness of the food. Food or liquid leaking from your mouth or nose. So because what you have a flap in the back of your mouth that closes off so things don't go into your nose. But if that flap is weaker, it might not close off and you get some food or liquid up there. Increased time needed to chew food. So that could be all of those mouth muscles may be uncoordinated or weaker, or you don't feel it, you aren't aware of it. And so that could result in needing more time to chew food, especially like chicken, steak, things that really involve a lot of chewing. That could take you even longer to chew if those muscles are having a little bit of trouble. Complaint of food sticking in the throat. And this one's a tough one because that can be caused by a lot of different reasons. And sometimes we have to get other providers involved because it might be an actual like stomach issue because maybe it's not actually stuck up here and you just feel it in a different way. But that could also be that that opening is not opening for the food to go in, or it's getting stuck somewhere in your esophagus, or it's getting stuck in your throat because of weak muscles. Again, a lot of different reasons. Pain with swallowing, that one's a tough one because that could also be for a lot of different reasons. Wet or gurgly sounding voice during or after eating or drinking. So that, think of wet, like, you kind of hear that, you've heard that all before, like that kind of gurgle. If you think about that your vocal folds are right at the top of your stomach tube, your vocal folds are what vibrate when you talk. So if something's there or something's in the way, it might sound gurgly. It might have some saliva there, it might have some liquid there. Your voice might sound gurgly after. Coughing or choking, I think that's our obvious one, right? When our body's reflexive response to something going down the wrong way or something being there is to cough or to clear your throat. That's a good response because that means your body is feeling it and knows that something needs to be cleared. But it's not good if you're coughing a lot. It's good that you're coughing because then you can clear it out, but it shouldn't be occurring frequently. But that's usually the big one, the coughing, choking. It's kind of I don't want to say obvious, but it kind of is the obvious one. Coordinating breathing and swallowing, because you have to stop breathing very temporarily to swallow. Remember, our airway closes off so things don't go in there. So if you're having trouble coordinating, you get really short of breath when you're eating or drinking, that could be a problem with coordinating breathing and swallowing. If you get a lot of pneumonias or respiratory infections, that could be that things are going down into your airway and your lungs are saying, hey, I don't like this food or liquid in here, and it results in an infection. So if we're starting to see a lot of pneumonias, it could be that things are going down the wrong tube into your airway. Extra effort or time needed to chew, I think I talked about that. Changes in eating habits, and that could be that you're not even realizing it, but you're avoiding drinking water, but it's because maybe you're having trouble swallowing the water. So you're just naturally like, well, I'm not going to drink it, but that's not good because we need water, right? So if you're noticing that you're starting to avoid certain types of foods or drinks, that could be an indication of maybe some swallowing changes. Weight loss or dehydration, again, it may be because you're not eating or drinking as much as usual. Your nutrition is different because you're only eating one type of food. That's the only thing that feels good when you swallow, things like that. And then again, this is not everything that you can see, but a pretty lengthy list. Any questions about any of these? Yeah.
You did mention swallowing pills.
Oh, yes. Pills, he said. Pills are a tough one. If you think about pills that, that's a solid that you're swallowing. Usually you're swallowing that solid with a liquid at the same time. So solid, liquid, same time. And then all of those things also have to coordinate at the same time. Pills can be very difficult, but we'll talk about some things to think about and strategies with that too. But that's a big one for a lot of people. Yeah. So. Yeah, so the phlegm is your body reacting to something being there, and your body and your lungs create phlegm. If you think about when you're sick, you're more phlegmy, right? Because you're fighting that, so you're creating mucus. So if you're coughing up phlegm more than usual, it's probably your body has like grown that phlegm, and it's more because it's fighting it. But it's good that you can clear it and bring it up though. Sounds like we're gonna have some talking later. Yes, and that's why we're doing this talk too. Okay, I want to talk about the 2 different swallow tests that could happen. The one on the left is an X-ray of your swallowing. This is pretty cool because this is a picture that's happening at the same time. So the camera that's looking at the one on the right, you can see the tube in their nose on the left. So it's actually the same picture happening at the same time. So to me, that's really cool. I don't know about you guys, but to me, it's cool. But the one on the left, that's called a modified barium swallow study. It has other names, video fluoroscopic swallow study. But this is typically done at hospitals as an outpatient or inpatient if you're in the hospital. Around here, they are done at Upstate, Krause, and St. Joe's, I believe. But this is just a video X-ray while you swallow. So the speech therapist would give you a bunch of things to eat and drink. It's all mixed with barium, so you could see it on the screen. And actually, remember we looked at that picture of your side view? So this is a side view of your swallow. It's flipped from my last picture, but you can see in the throat, see the dark stuff that's collecting here, and then it's dripping down here. That's the liquid still sitting in this person's throat. I don't know if they haven't swallowed yet or what they've done, but then you can see that same liquid on the right. So here's that view from the top. And this is during a fees. Yay, we're finally talking about fees. So this is that camera, that little tube that's going in through the nose, and it's hovering right above the throat. And that's the way we're able to actually see it real time with the camera, with color, real time, and we can see what's going on with the swallow. That makes sense, like just visualizing it?
Specialist decides both or one or the other?
A speech therapist is involved with both. The one on the left has to also involve a radiologist. The one on the right can be done anywhere. Like somebody, if they have the equipment, can come to your house and do it. Yeah. We'll do it. We do it in the office, which I'll talk about. So here's the fees again in a couple different pictures. So it's a tiny, I call it like the size of a spaghetti noodle. It's not very big. Got a little camera with a light at the end. It feeds in through your nasal cavity and then just kind of hovers over your throat. So you can see the lady on the left, she has that in her throat with the little camera's light on. The one on the right shows a dummy with the camera in there. You can see it lights up. And then there's our image, and that's a beautiful looking throat right there. Okay. I'm sorry. Do they? Sedation, no, because you have to swallow. You can't be knocked out, right? Be nice and awake. It's not. Kate? She's been still. Yeah. I don't know, has anybody ever been to an ear, nose, and throat doctor, ENT, where they went to look into your throat? It's the same thing. It's the same thing. The way I describe it, and maybe if you have other words, it's a little bit of pressure when it goes through the nose. Soon as you're through the nose, you barely feel it. Yeah, do you agree?
Like the discomfort when like there's that water coming up your nose, something like that. It's uncomfortable but not painful.
Yeah.
So you both had this done and you're speaking from experience.
Yeah.
Yes. Okay. So if you were to come in for fees, again, like I said, it is done in the office. We can do it at Engage. That I know of a handful of other places that will also do the study in Syracuse. I don't know their experience with individuals with Parkinson's, though, so I'll just give you that caveat. It's used to assess swallowing, and it's a real-time video of your swallowing. So if you come in and say, hey, I have trouble with turkey sandwiches, then you bring a turkey sandwich in, and I watch you eat a turkey sandwich with the camera in there. We'll see what's going on. Or, we usually try something soft like an applesauce or pudding, and then we'll try like a mixed fruit cup, so something to chew and swallow. then a cookie, cracker, and of course, liquids. But if there's a certain food, or we could try pills even, you bring your pill that you're due for and we try a pill and we can see what's going on, right? It's done right in my office. You sit in a regular chair. It's a kind of a small office if anybody's seen it, so it gets a little cramped, but it's okay. We make it work. And like I was explaining, it just goes right into your nose. We sit there and it's minimum, I would say 4 minutes, maximum if we're really going and trying a lot of foods, maybe 10 minutes in your nose, but it really all depends on what you see. So it's pretty straightforward. I also would have you say some words so I can see how those vocal cords, that triangle, are vibrating and moving, just if there's any concern about how your voice is sounding or how you're able to close off your airway when you swallow. I may have you try different positions, like say, hey, let's turn your head this way, or let's go look down, or, and we can just trial things right while that camera's in there and see if there's something that can help things go down safer. Right. So that's what's nice about, we can do it right in the office. We just try what we need to try. And if we have to repeat it a month later, we can do that too. It's very simple. What's harder with the x-ray is you have to get a script. Well, you have to get a script regardless, but then you have to coordinate with the hospital, and then they don't call you back. And then they say, oh, we have an opening in 4 months. And then so not that there's anything wrong with that kind of test, but it's a lot more straightforward to do the fees because there's a lot more convenience to it. All right. Any questions about the fees in general? Was it for like reflux?
Yes.
It was probably like a pH impedance study, maybe, or the motility. There's that one. That was probably on an X-ray where they watched it go down gradually. That's different from the X-ray if you're swallowing, just because they're focusing on different things.
It's a meter. There was a meter, and as they swallowed, the meter gave a readout of what direction the swallowing was going and how much pressure increased on it.
Was that done at a hospital? So that would be helpful for what we would do swallowing wise, because sometimes issues with your stomach or esophagus can actually affect how your throat is functioning too, because it's all a pressure system. Because if you push something down, you got to have some positive, negative pressure to push it. So if something's going on in your gut or your esophagus, that could affect your pressure. So that sort of stuff is good information for swallowing in general. So I kind of went into what we would see related to Parkinson's, but what I was talking about with the list of signs or symptoms that you would see, I kind of, talked about that a little bit. But if you think about any sort of muscle weakness, muscle coordination, any sort of tremor, those in any of those muscles, because it's muscles and nerves doing the work, if any of those are disrupted or incoordinated, anything like that, we could see a change with any part of once that bolus enters your mouth. But everybody's different, so it's not like you'll see this, right? And that's what makes it hard, but that's why we have to assess it, kind of break it down and see, where is the breakdown of the swallow and how can we help with that? So how can speech therapy help? Once we do a swallow test and we identify, oh, it's this muscle, oh, it's this part of the swallow, oh, it's maybe you just need to do this type of strategy, then we can then work on it. There are swallowing exercises, but we have to know what muscles to work on. So that's why we have to do the test to know, because I could say, hey, do these swallow exercises, but that might not target the muscles that you need targeted. There's we call them oral motor exercises. So those are face mouth exercises. So we could strengthen them. We could improve the range of motion, like getting the tongue moving side to side so that you can move your food side to side. Anything like that, there's exercises that we could do based on whatever we see. But we, Pretty much. It doesn't, it's not saying like, it's not like your muscle lights up and say, hey, this is the muscle we need to do. But if I see, for example, if I see food sitting in a certain part of your throat, based on what I know about the swallow and what I saw, I could say like, oh, the back of your tongue is weak because it didn't push the bolus down, just as an example. So then I would know, okay, we're going to work on the back of your tongue, right? So it's based on what you see and then my analysis of the swallow, if that makes sense. Yeah. It's very. Steak's a tough one for a lot of people. It's delicious, but can cause some. He's a little scared. Did somebody else?
Yeah, it's true, I heard that.
Can be helpful for some, it cannot be for others.
And is there any?
As in like a device stimulating or just like. Absolutely, because there could be that we could see a reduction in your sensation of your muscles or the overall awareness of your muscles. So doing like stimulation or like kind of like an awareness training, yes, it'd be very helpful. Then we wouldn't see as much like drooling or food coming out or food pocketing, you know, chipmunking in the cheeks, things like that. So yeah. Not following the question, I'm sorry.
Speech therapy.
Right. Yeah, and that's the tricky part with speech, because there's speech and then there's like all of these things under speech therapy. So I think you'll get used to this, Kate. We have a way of explaining speech therapy because we'll have people come in, they're like, why am I here? I don't have trouble with my speech. Right, but you have trouble with your swallowing, and that's under the umbrella, right? Or, oh, right, you have changes with your thinking skills. That's under the speech therapy umbrella. So that's a tough one. There's a joke going around speech therapy. It's that we should be called the speech, language, voice, swallowing, cognition, blah, blah, blah therapist, because we can do so much. Yeah. So it does fall into there. Yeah.
We do, I don't know if everybody's aware, but on Wednesdays, it's breaking out September. There's a thing on TV.
Yeah.
And almost singing facial announcement, you face up, big now, do all kinds of facial exercises.
And I'll also put a plug in for Loud Crowd, which is on Mondays, right, Ron? Mondays at 10:15 is Loud Crowd, and similar to that, but it's not singing. Well, we don't do singing. You don't want to hear me singing. But we do speech exercises that are a part of the Speak Out program, or also called LSBT is another Parkinson's specific voice therapy. So we do this similar things where we all together do exercises for speech and voice. So, and that if you're a part of Empower, you can join. It's on the email that you get. Just click the link and you'll see Kate arrive. Yeah.
I really have a comment and a question.
Mhm.
And speaking from caregiving experience, I just want to say to everyone, the caregiver, communication is so important.
Mhm.
I call it mandatory. Because sometimes if it's not communicated, you don't know why they're cutting up their dinner in tiny pieces. I thought, you know, I like the dinner, and I'm a very good cook. So this took a couple of weeks. So I think communication is important. So at what
Absolutely.
stage, I realize each individual has to decide when it's time to come and see you.
Mhm.
When you can't swallow anymore, you don't want to wait. So-
Right, because there's some pretty significant consequences to having trouble swallowing, like choking or pneumonia or hospitalization because you're so sick with pneumonia. Yeah. So yeah, great question. When is the time to come in? If you're able to do those strategies that, you know, you've tried at home, like cutting it up small or taking your time or not getting distracted, things like that, and that helps, kind of keeps it at bay for a little bit, great. But when it starts to be, you're seeing a lot more coughing, you're hearing that gurgly throat coming, you know, and this could be coming from the caregiver too. You yourself may not notice. So I think that is a wonderful point, is that communication, say, hey, I'm noticing a coughing after you're swallowing. Do you think we should talk about it? Should we both get it looked at?
Some patients, correct.
Yes.
Sleeping thing goes over.
Right, because, and then if we're gonna do swallowing therapy, you need to know why we're doing it, what we're doing it, for even it to be effective. You can't come see me once or twice a week and we do our exercises together and then it's better. You have to be able to do the exercises at home and have the carryover at home to see changes. So you have to kind of have that, I don't want to say buy-in, but you kind of have to, you know, you need to know why you're doing it, what you're doing for it to be effective. Right.
Did you say, or maybe we have suggestions for swallowing pills?
We can talk about that now. Yeah, so pills are hard. We all know that. Yeah. And a lot of them can't be cut or crushed, which is also troublesome. But quick caveat on that, if your pill can be cut or crushed, that could be a good strategy to help with pills. If they're big ones, if they are allowed to be, you can cut them smaller or crush them and put it in applesauce, pudding, mashed potatoes, whatever. That's a good way to kind of bypass having to swallow pills. But a lot of cases, and especially with Parkinson's medications, that you can't cut or crush them. So there's some in general strategies, but you know, obviously it's not all of the strategies, because everybody, if we looked at how everybody swallowed pills in this room, everybody does it different. Some people throw their head back, some people tuck their chin down, some people do one, some people do the entire handful. Everybody does it different. So one strategy is not going to work for somebody else. But the first thing I would say is, if you normally take a few at a time, try doing one at a time. Or try doing your small ones first and work your way up to your big ones, so that you kind of almost like get yourself started, right? Kind of like warmed up for the swallow. One thing I like to think about, remember how we had the picture up and your tongue has to bring the bolus back to swallow it, right? Think about your tongue as almost like a cup or a bowl, and you get that liquid and pill in that bowl and then bring it back all together. Sometimes what happens is you swallow your liquid and your pill sits on your tongue and it's like, oh, that didn't work. So think of it as getting that pill almost like swimming in the water. I think it's a weird concept, but having it all together so that you can swallow it all at the same time. That makes sense. Think about it that way. Some people put the pill in first, then a drink. But if that's not working, try put your drink in first. You have that water already and just pop that pill right in that liquid, swallow it down. So you can try to think of maybe some of those strategies. If some of those are not working, we can, I've had people swallow a Tic Tac during my test, and that's our test to see how you can swallow a pill, right? So we can try strategies with a Tic Tac. I know it sounds funny, but it's okay, it's safe.
You use other liquids or water's best?
So I want to say water is best, because if anything is going to go down the wrong tube into your lungs, if you have trouble, water is the best, because if it's pure and clean, your lungs will absorb it. If it's orange juice, or if it's acidic, or if it's soda, please don't do soda. That's not, you know, your lungs aren't going to absorb that as well. But you can also take a whole pill and, like I was saying, putting it in applesauce, putting something smooth that you don't have to chew, where it can just all stay together. You just down the hatch, right? But I like to say water's the best, just for that reason. You could try something a little bit thicker too, like, you know, like a milkshake or something. Sometimes a little bit thicker kind of stays with the pill and swallow it together. Yeah. Oh, and then it probably tastes terrible, and yeah. So the quicker but safer that you could do it, the better, because for that reason, because some pills break down so quickly. Really setting yourself up for success and really prepping yourself before you put that pill in there, in that case, yeah. Yeah. Oh, questions. I always have to have one, because at the end, speech therapy is a big deal. Any other questions? And I apologize that I was going to bring flyers for fees, but I was homesick with my daughter this morning, so I did not go into the office, but maybe we can bring some flyers for the fees, and speech therapy in general. We could just leave them here. Yeah. So I apologize. I was gonna have some today, but unforeseen circumstance. Yeah.
Does alcohol affect the swallowing?
The question was, does alcohol affect the swallowing? Technically, the swallowing of an alcohol, no. But it can affect a lot of other things that can impact swallowing. So I'll leave it at that.
So then you're better off having water in that.
Yeah, yeah. Mhm. I'm gonna let your doctor answer that one. There's our information, there's our website, our phone number at Engage Therapy and Wellness, info@brainbodybetter. If you've ever met Dina at the front desk, she's amazing. She would be answering those emails, or she could forward an email to me, but my email is just Kathryn@brainbodybetter. Kathryn. I do, and I think I have some right over there. You want to walk around? Yes, no. But in general, if you just want to, you can just contact Engage. We talk every day, so a message would get to me. Yeah. And then I'll bring some flyers for some swallowing, more swallowing information. But if you're unsure about a swallow study in general, you can come in for just a swallow eval, where we talk, I get your history, I get your information, and we say, hey, do we even need to do a fees? We might not need to. It's not 100%, we do the camera ourselves. So we could just come in, I could do a swallow evaluation, try some things to eat, drink strategies, and we go from there. But in order to see me, I do need a doctor's script. So you can get that from your PCP or your neurologist. But I do need that in order to see you. I can answer general questions, but most except Fidelis and some of the not as common ones, but Medicare, Excellus, Blue Shield, those. I thought at one point, I think actually, does this one might be an insurance one? Questions? I can talk to you individually if you don't want to ask questions in front of the crowd. But feel free to call or email with any other questions. We're here to help you with whatever you need.
Good job.
Thank you. Thanks for